Good work. It's my pleasure now to introduce Bart Carlson from Napersoft, the CEO of Napersoft, who will be demonstrating, I guess, the new tool that you've been very excited to unveil after months of research and development.
Yes.
So, Bart, thank you.
Thank you.
Okay.
Nice to be here. Nice to be here with all of you this afternoon. We're going to be talking about a new platform that we're developing called Text2Health. And essentially what it is a blue button, patient-empowered payer to provider electronic health record exchange. Just as a little bit of background, we are a software company. We've been in this space, which is somewhat usually called customer communications management. What does that mean? We've been helping health payers communicate claims transactions to their customers, or patients, if you will. So things like EOBs, or explanation of benefits, we help payers create that, and other kinds of communications. So we've been processing claims data for many, many years. And so as we heard about some of the challenges within the industry and some of the new technology that was available, we said, what are the basic problems? Is there some way that we could help solve some of those, possibly using what we've learned over the past couple of decades going forward? So from what we've seen, providers have problems with they don't have complete information. Oftentimes when somebody has a new patient, they walk in the door, they fill out 5 or 10 pages of forms. Depending on that person's recall, they may be easy to get that information. Even if they do get it all, they have to rekey it all into their system, and it takes a lot of resources. Also, for the payers, there's a continuing rising cost of medical errors, and much of this is just because of incomplete information that the providers had at the time of service. And so we were trying to say, could we help them solve some of that problem through helping the providers? And finally, the patients themselves have some new things available. For example, the new blue button movement that VA created and others are adopting. But there's still some issues with that in terms of it's difficult to read and understand. It's not in a very user-friendly format. And this often leads to some issues in terms of communicating with payers and providers. So what is the solution? Basically, what we're looking and thought might be a good idea was what if we could put patients in control of their claim data that was already at their payers and be able to provide that at the time of service to any provider. And what might be some of the benefits? Would it improve some of the outcomes in terms of those treatments? Would it reduce possibly some of the medical costs that we all have heard about earlier today and for many years before this? So what we did was to build a prototype taking that blue button text output, and you can see an example here of what it typically looks like. And we said, okay, let's take that data, put it into a form that can be used by other engines and delivered not only to our engine, but to other systems, payer systems, as we went forward. As an example, we took that data, converted it into XML, and we put it into a PDF. And in this particular example, we took 22 pages of blue button output text and converted it into tables, reformatted it so it was easier to read, put some headers and formats on it, time and date stamped it, and made it much easier to read. But the bottom line was we reduced it to 8 pages of output. So what does Text2Health do in terms of solving this problem? Well, there's a couple of steps. So basically, it takes all the data that we have currently being collected and within the databases or the data sources of healthcare payers. It takes all of those patient care systems and ways that we operate, whether it be doctors, emergency rooms, hospitals, and so on, and gives them the ability to get access to that data on a real-time basis, whether it be in print or email or fax or in electronic health record forms like HL7. And so what we're doing is taking the engine that we've been using for years to process this data, putting it in a centralized portal, if you will, that is controlled by the individual patients. And essentially what they do is they put into the system their authentication information for each of the payers that affects their particular health care records. Underneath that platform then is this Napersoft CCM document platform, which is this tool that payers have been using to provide some of these other healthcare reporting mechanisms I mentioned earlier. So how does it work? Well, for the payers, it's pretty simple. Number one is provide some kind of secure patient access to their website to get access to the data, and provide a blue button download of the electronic health record in a text format as part of that sign-on process. That's all they have to do. If they've already done that, they've done their work. In terms of the patients, we are in the process of developing 3 different device platforms. One of them is a smartphone, tablet, as well as web-based. And essentially what they do is they go to the device, they start the Text2Health app, they log in, they select whichever payers they want, they select the provider that they want, they specify and click on send it, and based on how that provider wanted it, we manage that data going over to that system. They log out of the app, and they're essentially done. So instead of walking into the office and filling out 5 or 10 pages of information, when they're having that first meeting with a new provider, because they've been referred to that provider, they can now just simply start the app on their smartphone, on their tablet, and move it directly over into the provider's either email system, their fax, or using electronic health records into their system. So how does it work for providers? Well, essentially, they get an email that says somebody's trying to transfer information to you. They open it, the secure email, they log in, and it asks them how do they want to take it. Do they want it just to view it? Do they want to print it? Do they want to import it? If they click import, it creates a file that is now imported into their system. They log off, mission accomplished. To get started with this, we developed really kind of 2 phases. One is to help individual payers be able to use their current user interfaces, typically a web user interface, and we built a prototype using the CMS interface, which I'm going to demo to you here in just a moment. Essentially what we do is we connect our back office engine. We use Microsoft Word to create the templates of how the data is coming in and going out. We then define the data source, which is that web source, in this particular case, CMS. We define what outputs they're going to be, whether it's going to be a PDF, it's going to be email, fax. We also, as part of the process, control all of the data that's being transferred, and we keep a record of it so we know who, when, what, and where any item was transferred. And essentially, what I'm going to show you right now is a quick demo of that. Assuming our internet is connected. So I'm not connected to the real Medicare.gov in case anybody's here from CMS. This is just a copy, a simulation. But essentially the way it works is you start up the web app, you type in your name, John Doe, your password, etc. You click in on sign on. Okay, there we go. And based on that, it comes up with some summary information to tell you and reinforce that you signed on as the right person. As probably most of you know, if you see this blue button logo, that means that there is data accessible and ready that you can download. And so what I'm going to do is click on that button, and essentially what we've done is add a third screen to the current Medicare.gov site. And it says, would you like to view that document in a readable form? Maybe you'd like to distribute it. So you click the Distribute It button. You can now type in an email, and just to save time, I'm putting a couple of them in there. And you can type in a subject if you were a good typist. And if you were wanting to be friendly, you might put in something like, "Hi, we are doing a demo." And you could click the fax it if you wanted to and put in a fax number. And then essentially, just by clicking at a button, again, whether it's on your smartphone, on your tablet, you're on your home computer, you're in your office computer, wherever you might be, essentially it's downloading that data as we're speaking. It's taking all that, reformatting it into XML, so it can be used by lots of different engines, and it put it into a PDF, as you can see right here. And let's see if we can't resize this. Oh, where's my resizing thing here? The light is shining in my face. I can't see it. Well, let's do this. We'll make it smaller so we can see a couple pages. So you kind of get an idea of what it looks like with the headings, the date and time stamping. If there are photos, we include those photos as part of the download. All of the other data is reformatted, and this is that 8 pages that I was telling you about. And essentially, when we're done looking at it, we can page through it, we can forward it, review it ourselves, forward it on as need be. And when we're done, we just hit next, and it brings us back to the home sign-on page where we had been and started the application. So depending on our internet speed here, I see I've just received an email. It came in, and here is, in this particular case, it was sent that PDF as an attachment, but it can be a link where you go back in and download it in a secure manner. And here it is, the real PDF, ready to save on our hard drive, to print it out, or whatever the case may be. So within a few seconds, essentially the patient is able to share their records with their provider and be able to get that information so they can review it themselves and have it for reference. So that's where we are right now, but one of the things that we're starting to work on and what we envision is being able to have an exchange that works for not just a single payer, but multiple payers. And we're working on 3 things. And one of those is the ability right now with the CMS system is working, but to add other payers, whether they be commercial or governmental. And this is just a few examples. The second thing we're working on is building a universal web, tablet, and mobile user interface so you can use it when, where, and how you want to. And the third piece that we're working on is actually taking that information and delivering it using HL7 so that it can be input either with Bluetooth, downloaded as I was describing earlier, or whatever form the provider wants. So, what are the benefits? Well, number one, we believe that there's real-time access to electronic health records, as we've been talking about, and many of us have been working on for years, is a real benefit. This provides it at the time of service. It also puts it in the hands of the patient. But the bottom line is it provides better information, and we believe reduced medical error rates for the provider, which is a win for everyone. We also believe that by doing that, it will reduce costs due to those reduction in medical errors. And finally, just the time that's being wasted. If you go into any kind of a provider's office, like a doctor's office or whatever, all the forms and all the data that you have to remember on each single visit for those especially for those new visits, is sometimes overwhelming to patients. So reduce that amount of time, reduce the side effects from prescription or medical errors, and bottom line is really improving the quality of care and outcomes for our patients throughout the country and hopefully someday throughout the world. So we think it's a win-win-win, a win for the providers, a win for the payers, and a win for the patients. And we are exhibiting here at the conference. Just a quick slide on some of the team members that we have here. We've got Ted Haddad and Christine Lou Ryder here from our federal operation. We got Joyce Hunter, who many of you may know from being in the health world, and Ed Hebda. We are looking for partners, and we're looking for opportunities that, whether it be for a single payer or something broader, and so we welcome you to come in and chat with us. Any time for questions?
I'm sorry, Bart. Thank you very much, though. That was really interesting. Thank you.
All right, thank you. Thank you very much.